Welcome, Professor Wakefield. Thank you for your time this morning. In Australia, we've seen several states and the Commonwealth Government use mass media-led public education campaigns in their efforts to reduce smoking. Just how important are they as a strategy to get smoking down in the community?
I would say they're one of the kind of big 3 or 4 tobacco control strategies that we know really reduce smoking prevalence. I think they're incredibly important, not just because they encourage smokers to think about why they need to quit smoking, and they can direct individuals to sources of help to quit, but they also remind people who've quit why they should stay quit. And they have an impact on denormalising smoking as well, and that's really important for young people to help them avoid taking it up.
From your research, what are the themes in that advertising that are most effective in promoting quit attempts from smokers?
From all the research that we've done and research around the world, the most kind of reliable impact for encouraging smokers to quit comes from campaigns that really sort of seriously emphasise the harms of smoking, and some of them use fairly graphic methods to do that. Other campaigns use personal stories, but really it's a sort of capturing the serious health consequences of smoking that seems to get the most response from smokers.
And in terms of frequency of exposure of the messages through television advertising for these campaigns, do the campaigns have to be as large and have the budget that commercial operators have access to?
There's actually some good research about how much sort of reach and frequency campaigns have to have. Our campaigns in tobacco control, I think, are extremely well researched, and they're quite potent in their messages. So we don't need the kind of broadcasting that commercial advertisers require, but we certainly do need a serious level of investment, and that level of investment with the right frequency will reliably show returns on reducing smoking prevalence. So you can't get away with a once-a-year campaign by any means. You should try to be on air really as often as you can, and rotate your messages around so that they're fresh.
And if these television advertisements prompt quit attempts among smokers, is it vital that they're supported with other resources from community and health groups to maintain their non-smoking status?
Mass media campaigns are just one part of an overall comprehensive tobacco control approach, and they're really designed to complement other types of policies and smoking cessation help resources that are out in the community. So when a mass media campaign's on air, for example, it kind of empowers doctors to talk to their patients about not smoking and providing referrals and advice for them to quit. It sort of activates other parts of the healthcare system to raise the issue of smoking, and it also, I think, creates discussion among people in the community about smoking as well, and that's a really important way in which smokers can be led towards making a quit attempt. I mean, if your kid sees an ad on TV and raises the fact that they're concerned about your smoking, that's a pretty powerful sort of personal message that could well prompt someone to make a pretty serious quit attempt.
So, Professor Wakefield, we've talked about predominantly television advertising that's been used in Australia and North America and other places to promote quit attempts by smokers. Just how important is the emerging use of social media to get these messages across?
Most advertisers know that still today, televised media is by far and away the largest kind of media or channel through which people still get information and are exposed to advertising. So campaigns need to be television-led. That's not to say that new media and social media couldn't play a complementary role. They do. They're extremely important for people, I suppose, as a complementary source of media to help people discuss issues to do with that are raised by the televised advertising. They can be, and it can be a very important mechanism through which people might get information about how to quit smoking, for example. But in general, televised campaigns are really still the channel through which most advertisers know you. If you're going to impact the whole population, that's how you're going to get the main reach.
And from your research, have you been able to answer the question as to whether you need separate campaigns for adults versus children?
At first blush, you would think that you would need separate campaigns for children and separate campaigns for adults. But the research overwhelmingly has found that if you've got great campaigns for adults, those campaigns have flow-on benefits for kids. And so the hard-hitting messages, which are about the health consequences of smoking, are designed to primarily engage adults, to engage adult smokers and really make them feel the risks of smoking. But at the same time, those messages are seen and processed by young people as well. And of course, young people think they're immune to the health effects of smoking. But the way in which those messages work with young people is that it makes young people think about how ridiculous and how disgusting smoking is. And that through that mechanism, those kind of campaigns have a 2-for-1 effect on impacting adult smoking and children smoking at the same time. And we can see that in our data in Australia. We've seen young people smoking come down across the whole nation. And really the nation has used adult-focused campaigns that whole time.